Hi everyone, it's so good to see you again. I'm so glad to be with you. As usual, my name is Dr. Ezebasi, and we are going to start a very interesting series. I've been wondering, all my viewers that have been watching the teaching series, the clinical chemistry series, what can I do for them as a bonus? And I said, well, why don't we practice laboratory posting questions together? And that is exactly what we are going to do. Stay tuned. So, like I've said, we're going to be doing clinical chemistry laboratory post-exams, practice questions, part 1. This is usually for people who have just been introduced into the lab. For us in the University of Calabar, that will be the people in year 3. So, you're going to do the practice question series with me. So, like I always say, thank you so much for your support. We are getting higher and higher. Please, I would love for you to for you to share, subscribe, and comment on our videos. Tell us what we are doing that is right, what you would like us to include. Share this opportunity with somebody. Somebody's just waiting for this. Please share this out, and I'll be so grateful. All right, let's go. So question number 1. The plain 5 ml bottle sample container is best suitable for A, storing of serum or plasma for biochemical tests, B, collection of whole blood for biochemical tests, C, collection of CSF samples for chloride quantitation, D, collection of calculi for quantification tests, E, collection of CSF sample for protein quantification. So what do you think is the answer? For me, I will choose A, that's storing of serum, plasma, or serum or plasma for biochemical tests. That's usually what you use the plain 5 ml sample container for. The plain 10 ml would be to collect blood, while the plain 5 ml would be to store your serum or your plasma. So if you have an emergency and you need to do EUC quite fast, what sample container of choice would you use? A, potassium oxalate sample bottle. B, 10 ml plain sample bottle. C, Vacutainer sample bottle containing EDTA. D, lithium heparin sample bottle. E, fluoride oxalate bottle. Remember, you want to do this EUC fast, so you don't have time for blood to clot. So that rules out B. Potassium oxalate, remember you're doing EUC. Potassium is one of the electrolytes. You ain't want to use that bottle. Then Vacutainer sample containing EDTA. EDTA comes in as either sodium salt or potassium salt. So you don't want to be using that. That would disrupt your results. Then fluoride oxalate bottle. It comes in as sodium fluoride and potassium oxalate. You don't want to be adding those two to what you already have in the blood. So that will mean we are going to use the lithium heparin sample bottle. All right. So in the fluoride oxalate sample container, A, potassium oxalate is not the anticoagulant. B, sodium oxalate is the anticoagulant. C, calcium oxalate is the anticoagulant. D, potassium fluoride preserves the glucose. E, potassium oxalate is the anticoagulant, and sodium fluoride inhibits the enzyme enolase. E is true because that particular sample bottle contains two things: potassium oxalate, which is the anticoagulant, and then sodium fluoride, which inhibits the enzyme enolase, thereby preserving glucose levels. So if you chose that, you are correct. Well done. So number 4, unless specifically requested, which of these analytes is not routinely acid as a part of electrolytes? A, sodium. B, potassium. C, bicarbonate. D, chloride. E, lithium. Which one would you choose? I would go with lithium because all the rest are routinely done as electrolytes. Lithium is only done when requested, and usually it's for psychiatric patients where they need to monitor their lithium levels because of the drugs that they're taking. So question 5, The part of the colorimeter that displays absorbance reading is called photocell, cuvette, galvanometer, photomultiplier, light filter. Dun, 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 dun. Which one will you choose? We will go with galvanometer. That is the part of the colorimeter that displays absorbance reading. State the Beer-Lambert's law. A, absorbance is indirectly proportional to concentration. B, absorbance is inversely proportional to concentration. Is there a difference between the two? C, absorbance is proportional to concentration and transmission. D, absorbance is inversely proportional to the light path. E, absorbance of light is directly proportional to the sample concentration and the light path. When you talk about the light path, you're usually talking about the light path of the cuvette, and I choose that as my answer. All right, 7. Which of the following is not a maintenance practice for a laboratory centrifuge? A, balance the tubes by ensuring equal and opposite width. B, keep the centrifuge properly lubricated. C, cover the centrifuge while spinning to avoid aerosols. D, open the lid while it's still spinning. Who wants to do that? That's dangerous. E, pay close attention to noise, vibration, shaking, or grinding, and stop the centrifuge immediately. So what is your answer? Is that your final answer? Also, I will choose D. Open the lid while it is still spinning. That, if you do that, you will have so much aerosols, you can infect yourself. So many things can happen. The sample can just jump up and paste on your face. That will not be funny at all. All right, so question 8. Which of these is a quality of deionized water? A, it is iron-free. B, it tastes salty. C, it is grayish-white in color. D, it is pyrogen-free. E, it is a good conductor of electricity. It can't taste salty because all the ions have been removed. This is water from which you have removed ions. And because you have removed ions, it will not be able to conduct electricity. Yes, it is clean, but it may not be pyrogen-free, and it should not be grayish-white in color. So I will go with A. So 9, the tubes are held. I'm going to tell you a small story. So the tubes are held at a fixed angle, usually 45 degrees. And during centrifugation, the densest particles in the solution will separate towards the angle of the centripetal force. And the sedimentation in a fixed angle gives a slanted sediment. The most compact of these will be formed at 45-degree angle. Did you get that story? So what type of centrifuge rotor does this describe? A fixed angle rotor. If you are very careful, you would have seen this fixed angle. That is like giving the question away. So I will go with fixed angle rotor. Let's see another story. So for this particular rotor, the tubes are placed in buckets that are not fixed. And when the spinning starts, these buckets can swing out and spin at a horizontal angle out from the axis of rotation. This horizontal spinning allows samples to be resolved in density gradients and can produce or promote more effective separation of individual particles. Which type of rotor does this describe? It's not fixed. It can swing out. So which one do you choose? A swing out rotor. That is the answer. All right? Okay. Let's move. Question 11. The tubes are vertical during the operation of a centrifuge. The yield of the rotor is not as ideal as the position of the tube does not align with the direction of centrifugal force. You know, centrifugal force goes out. So as a result, instead of settling down, the particles tend to spread towards the outer wall of the tubes. So what type of centrifuge rotor does this describe? I will go with a vertical rotor. All right, let's leave rotors alone. Urine samples in plastic universal container is used for A, urine protein detection, B, urine glucose detection, C, urine bilirubin detection, D, urine nitrite detection. If you look very well, you'll find out that all these parameters are contained on the urinalysis strip. And remember, the urinalysis strip is used for detection of abnormal constituents of urine. All these ones I'm saying are abnormal constituents of urine. So having said that, which answer would you choose? I will choose all of the above. Very good if you did that. So, which of these statements is not associated with quality control sera? A, it provides a valid judgment on the accuracy of results by comparison with known sera. B, it monitors the analytic process and helps to find which method is more accurate. C, it can be generated from all samples and used to assign concentration values to the analyte of interest. Wow, seriously. Helps in evaluating the quality of the sampling. I will go with C. You do not generate it from all samples. All samples are already deteriorated. So why would you do that? And you cannot use it to assign concentration values to the analyte of interest because it is not a standard. It is a control. You use it to judge, the test, the accuracy of the test you're doing, and the analytical process through which that sample is being, or that result is being produced through. All right? So question 14. Urinalysis. Urinalysis is short for urine analysis. So urinalysis involves the examination of urine specimen to detect renal function, metabolic acidosis, abnormal constituents of urine, water balance of the body, acid-base balance of the body. So which one do you choose? Renal function, I would not go with that because there are more specific tests for that. You are not detecting renal function. You should be estimating parameters of renal function. Metabolic acidosis, no, I wouldn't go with that. Water balance, no, I wouldn't go with that. Acid-base balance, there are other tests that I use for that. So I will go with abnormal constituents of urine. Question 5. Dry proprietary reagent is used on which bench? A, urea bench, creatinine bench, serum protein bench, immunoassay bench, a urinalysis bench. If you have ever been to the lab, you would know that the first 4 are not correct. It is urinalysis bench. The dry proprietary reagents we use include your Combi 9, your Combi 2, your Albu sticks, your Clinic sticks, your Keto sticks, and all the sticks. All right. So question 16. Clinic sticks detects what? I'm not going to tell you this one. I need you to answer me first. Then I will now give you the answer. So what is your answer? Is that the final answer? So the answer is glucose in urine. Clinic 6 tests for glucose in urine. Whatever you want to forget, don't forget this. Albu sticks, on the other hand, tests for protein in urine. So Clinic sticks, glucose in urine. Albu sticks, protein in urine. Keto sticks, ketones in urine. Creatinine, you need to use the JAPES method to do creatinine in urine. Usually you don't use it for urinalysis. You have to do a more special test for creatinine. So referrals mixture, what does it detect? Glucose in urine, glucose in blood, ketones in urine, creatinine in urine, protein in urine. If you know, you know. So tell me. It's usually ketones in urine. So if you got that, good for you. 5 stars. All right. So referrals mixture, what is it made up of? A, ammonium sulfate crystals containing a small quantity of sodium nitroprusside. B, bromocresol green dye. Wow. C, picric acid. D, diacetyl monoxide. E, tetramethylbenzidine. So which is your answer? Bromocresol green dye is for measuring protein in blood. Picric acid is used as a reagent in creatinine estimation. Diacetyl monoxide is used as a reagent in urea estimation. Tetramethylbenzidine, what do they use it for? Is for developing color during ELISA when you're using microplate wells. So I would go with A. All right. So 20. Which of the following is not an abnormal constituent of human urine? A, nitrite. B, protein. C, bilirubin. D, ketones. E, urobilin. Dun, 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 dun. Which one do you choose? I choose urobilin. Urobilin is a pigment, part of the pigments that give urine its yellow color. All right, and it's a normal constituent of urine. The more concentrated the urine, the more yellowish, the color, and vice versa. Question 21. Which of the following are normal constituents of urine? I would need for you to look at these questions, or these answers rather, critically. A, nitrite. When you see questions like this, they're usually trick questions. So you have to look at them very carefully. A, nitrite, protein, and bilirubin. Those three are abnormal. Ketones, albumin, and glucose. Those three are also abnormal. You shouldn't see blood in urine. You shouldn't see hemoglobin in urine unless there's a problem. And glucose is a no-no. So that also is what? Abnormal. So the normal constituents will be urea, uric acid, creatinine. These are all nitrogenous waste. Inorganic salts of sodium, chloride, potassium, pigments like urobilin, urochrome, and co. These are the normal constituents of urine. So, question 22. Ideally, the best method of waste disposal in a hospital is by A, incineration, B, put in an open pit, C, spread on a white earth surface. That is callous. D, flush it down the drain. Wow, that's serious. E, recycling. No, you don't want to be recycling any waste from the hospital, because the first rule is that every sample specimen you see in the hospital is potentially a hazard. You just have to be careful in them. So the best thing would be to incinerate it, burn it completely. Don't put it in an open pit. That is bad. Rain will fall in it will sink into the ground and cause a lot of problems. Spread it on the white earth surface, you would contaminate a lot of people. Flush it down the drain. Remember that the drain will go back to the rivers. Why do you want to do that? To enter back into your water. Recycle. No, you don't want to do that. So incinerate it. The measurement of bilirubin is usually performed to investigate A, the cause of liver disease and jaundice, B, the renal threshold and hormonal disorders, C, in diagnosis of gastric ulcer, D, amniotic pressure, seriously, and acid-base balance in the ECM, that's serious. E, patients recovering from poliomyelitis. So which one is it? I will go with A. To establish a reference range for a particular analyte, A, apparently healthy individuals or subjects are used. B, mixed population is preferred. C, subjects with high values are used. Subjects with low value are used. None of the above. Usually, if you want to have a reference range, that is the range of a parameter for healthy people. It is when you have that range, you can be able to say, oh, this person has a problem. They has low values or high values, of it in respect to a healthy population. So we use apparently healthy individuals or subjects, okay? A spectrophotometer uses a dash to isolate specific wavelengths. A, glass prism. B, roton. C, condenser. D, light filter. E, carbon brushes. It actually uses a glass prism. There are also other things it uses. I will not tell you now. Till we get to the next question, you will see it. So let's go. A spectrophotometer uses all these except dash to isolate specific wavelength. A, prism, we've seen that in the other question. B, grating. C, interference filter. D, light filters. The strange one is light filter because you find light filters in colorimeters, but because of the specificity and the sensitivity of spectrophotometers, they usually use prism, grating, or interference filters, as the case may be. So if you're looking at pipettes, what is the best graduated pipette marked as? A, B, C, B, D, E, F. Which one would you go with? Usually the best is always A. Some other pipettes you will see AS. That also is a very high level graduated pipette. Okay, the S is to tell you that it has a swift delivery. Okay, so A or AS is usually the best graduated, or are usually the best graduated pipettes. So question 28. All of the following analytes are analyzed in the chemistry department or clinical chemistry department except A, fasting plasma glucose, B, lipid profile, C, electrolytes, D, coagulation panel, E, renal function test. If you have been watching Dr. Ify Okafor's videos, you will know that coagulation panel is the strange one out of all these. We usually do coagulation panel in hematology. All right? So, question 29. Which of the following are kidney function assays? A, GGT, alkaline phos, amino asparatate transaminase, alanine aminotransferase, 5' nucleotidase. B, urea and creatinine. C, trypsin, chymotrypsin, and amylase. D, lipase, amylase, and glucose. So which one is your answer? I'm sure you are used to alkaline phosphatase, asparatate aminotransferase, and alanine aminotransferase, but also gamma glutaminotransferase, that is GGT, as well as 5' nucleotidase, are kidney function assays. Okay, so kidney. Oh my God, it's the kidney. Urea, please. GGT, alkaline phosphatase, and co are liver function assays, while urea and creatinine are kidney function assays. Oh my God. All right, question 30. A serum sample is obtained by placing blood in an EDTA or sodium citrate tube and allowing it to clot before spinning it down. A, is this true? Is it false? All of the above. are true, none of the above. What do we choose? It's false. Usually, if you want a serum bottle or a serum sample, what you do is to put it in a plain bottle, okay, and allow it to clot. Or you can put it in a silicone gel container, allow it to clot, and then you spin it down and you pick it up. You don't put it in any type of anticoagulant bottle. All right, question 31. What type of sample can be used to test for protein? A, CSF, B, urine, C, serum or plasma. Since they have not specified the type of protein, we can pick all those samples. So we take all of the above. A round bottom glass tube with only one marking of 500 ml volume is called, the answer is a volumetric flask. Okay? All right. So what is plasma? What is plasma? Remember we talked about serum about 2 questions ago. So what is plasma? A, it is the liquid component of blood synonymous with absorbed proteins. B, the liquid component of blood including all coagulation factors except that removed by the anticoagulant. C, cellular components of blood above the red blood cells. Wow. D, liquid component of blood without the presence of fibrinogen. So which one would you choose? What is plasma? I would choose liquid component of blood, including all coagulation factors, except that which is removed by the anticoagulant. There are different types of anticoagulant. Some of them are known to chelate calcium, which is very important for coagulation. Some of them are known to inhibit the action of fibrinogen. I think that is like lithium heparin. Some of them are known to do different other types of things. So whatever anticoagulant you're using produces plasma, which is the liquid component of blood that has all the coagulation factors except that which has been removed by the anticoagulant. So 34. Which of the following is not considered personal protective equipment? A, latex gloves. B, goggles. C, laboratory coats. D, eyeglasses. So what do you think? 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 I will go with eyeglasses. All right? I will go with eyeglasses. All right? So question 35. In the spectrophotometer, the light source is the most important component. B, only the monochromaton is important. C, all components are important for accurate measurements. D, accuracy depends only on the sensitivity of the photocell. E, the color of the solution measured affects accuracy. That is the answer. So question 36. Cerebrospinal fluid, that is CSF for glucose assay, is best preserved in, remember if you're doing a glucose assay, you want to be able to preserve the glucose itself and you want to have plasma, all right? So what would you put it in? You want to preserve, so you put it in a fluoride oxalate bottle. What is the clinical significance of fasting blood sugar, or to be specific, fasting blood glucose? A, it is for assessment of glucose level in blood. B, it is for the diagnosis and management of diabetes mellitus. C, it is for the diagnosis and management of diabetes insipidus. D, it is for the treatment of chronic ulcer. E, none of the above. So what do you choose? It is for the diagnosis and management of DM. When you're doing a test, you're doing it for a purpose. And the purpose of doing a fasting blood sugar, or the significance of doing fasting blood sugar or glucose, is to use it to either diagnose diabetes mellitus, or you use it in the management of patients with diabetes mellitus. So, question 38. Urinalysis in clinical chemistry is a screening test. A, is a confirmatory test. B, it's a metabolic test. C, it involves the use of fluorimetry. What do you think? You don't use urinalysis to confirm anything. It's not a metabolic test, and they don't use fluorimetry. You use a dipstick. So the answer would be a screening test. All right? Then question 39. Example of explosive and flammable chemicals include ether, alcohol, mercuric nitrates, sodium citrates, sodium nitroprusside, and sodium hydroxide. Which one do you choose? I will choose ether and alcohol. Those are explosive and they are easily flammable, very, very flammable. Okay, question 40. Highly corrosive chemicals used in chemical pathology. Remember that chemical pathology is also the same thing as clinical chemistry. Include the following. A, strong acids such as concentrated sulfuric acid. You don't want to be playing with that. That can peel you up in the moment. B, sodium azide. C, salts such as sodium chloride. D, sodium bicarbonate. E, alum. So, what do you want to do? The answer is strong acids, such as concentrated sulfuric acid. So the last but not the least question, B, mention 3 glass volumetric equipment in the order of decreasing accuracy. A, volume decreasing. A, volumetric flask, measuring cylinder and beaker. B, measuring cylinder, beaker, and pipette. No. C, volumetric flask, beaker, and pipette. D, test tube, conical flask, and beaker. E, volumetric flask, conical flask, and pipette. Which one do you think is the correct answer? Remember, you are mentioning them in the order of decreasing accuracy. So we'll go with volumetric flask, measuring cylinder, and beaker. So thank you so much for listening. I'll see you next time. Please remember to share, remember to like, remember to comment. Thank you so much, and bye. Till I see you next time. Take care of yourself, and God bless you.